Good afternoon, everyone. I'm Dr. Sagar Katariya, and I'll be talking today on iron deficiency anemia. Uh, so let's see some basic facts. What is this anemia? What is iron deficiency? What are the causes? How it affects our body? What are the effects on pregnancy? How it will cause the complications and how to treat these. So let's see what is this anemia. So anemia is derived from a Greek word or Latin word which indicates anhemia. The hemia is for blood and an is for absence. So whenever there is absence of blood, it is called as anemia. So there are plenty of causes of this anemia. The anemia is because of deficiency of hemoglobin in the blood, and this hemoglobin is formed by two parts. One is heme part and the other is globin part. The heme part is made up of iron and the globin part is made up of protein, and this hemoglobin is incorporated into red blood cells. These red blood cells, the formation of these red blood cells depends on some other vitamins like folic acid, vitamin B12 or cyanocobalamin, vitamin C, and many other antioxidants. So whenever there is deficiency of blood or anemia, we have to treat according to the cause. And the most common cause in India and all over the world is iron deficiency anemia. And today we will be dealing with iron deficiency anemia. So what is this iron deficiency anemia? So most of the people in India are poor and they cannot afford a lot of food, and the food is most of the time deficiency in iron. So whenever there is deficiency of this iron, they cannot convert this iron into heme part of the hemoglobin, and so their hemoglobin is always low, and we call this as iron deficiency anemia. By definition, whenever hemoglobin is less than 12% for non-pregnant women and less than 11% for pregnant women, we call it as anemia. For Indian population, we consider 10.5 as a cutoff line, and whenever the patient's hemoglobin is below 10.5, we call it as anemia. This anemia is very common. Almost few studies have found up to 80% of the Indian population is anemic, and the most common cause, of course, is iron deficiency anemia. So why this iron deficiency anemia occurs? One, as I have already told, is nutritional deficiency. Few other causes, there may be some loss if a patient is having chronic heavy menstrual bleeding or bleeding from piles, or there may be blood loss from stools. There may be worm infestation, there may be inadequate intake, there may be some intestinal problems where this iron absorption is hampered. So these are different causes where the entry of iron into the blood is hampered, and so patient develops iron deficiency. So iron, whenever we eat iron, it is absorbed from intestine in the ferrous form, and it is stored in, it is transported by ferritin, and it is stored in the liver and all the bone marrow mechanism. So whenever there is iron deficiency, first the iron stores are utilized and then this iron deficiency exhibits. So before exhibiting, there is already depletion of all the iron stores. What are the different symptoms, or what are the different things where we can know this iron deficiency anemia? So first of all, patient feels, whenever patient is anemic, feels dizzy, inability to do heavy work, easy fatigability. There may be pain from right from head to toe, that means headache, body ache, joint pains, leg cramps. So most important, of course, is easy fatigability. So after doing strenuous work, patient feels uncomfortable, and this is the foremost symptom of anemia. Anemia, of course, it is diagnosed by doing hemoglobin estimation. It is simplest form of investigation, and each and every person must know her hemoglobin and what is the percent of hemoglobin she is having in her blood. Anemia, or especially the iron deficiency anemia, is more common in females because of menstrual blood loss and pregnancies, repeated pregnancies. So the common causes I have already discussed. So what investigations we have to do in this iron deficiency anemia? What are the other causes which leads to anemia, and how to differentiate between them? So whenever patient of anemia comes to us, we first do the hemogram, that is complete blood count. We do her hemoglobin, the RBC count, the size of RBC, the volume of RBC, then the content of hemoglobin in each RBC, what we call as mean hemoglobin concentration. Then we do the distribution width study, that is how many are small RBCs, how many are large RBCs likewise. And we do the differential count of WBCs and platelets and other things. Whenever the hemoglobin is low, then we should confirm it by certain iron deficiency anemia investigations like serum ferritin, serum iron, iron binding capacity. Likewise, one most important differential diagnosis for this iron deficiency anemia is thalassemia. Almost 2% of Indian population is carrying minor thalassemia or thalassemia trait, and they can be chronically anemic in spite of supplementation with hematinics or blood raising nutrients. So they can become chronically anemic because of this thalassemia factor. And this thalassemia is diagnosed by doing HPLC examination and hemoglobin variant analysis. So the screening of this thalassemia is very important and should be done in each and every pregnant woman, because when two thalassemia minor comes together, if suppose husband and wife both are having thalassemia minor or thalassemia trait, then the baby can have thalassemia major, which is uh, very threatening, life-threatening disease, and it can lead to severe consequences. So after seeing this, how to investigate for this iron deficiency anemia, let's know what are these effects of iron deficiency on the mother and the baby. So whenever there is iron deficiency, the mother of course is having less work potential. She gets easily fatigued by doing work. There are complaints of joint pains, leg cramps, backache, breathlessness, and headache, sometimes muscle pains. So whenever there is iron deficiency anemia, the complications may arise in the pregnancy, like the patient will have a low birth weight baby, then there may be intrauterine growth retardation of baby, what we call as fetal growth restriction. There is possibility of preterm labor in this pregnancy, and because of low hemoglobin, the immunity of the patient is low, and so she is uh, exposed to high risk of infection. So infections are common in these anemic patients. What are the effects on baby? Of course, the weight of baby will be low, and there will be growth restriction in the baby. And few studies say that because of low iron levels, the baby's IQ can be low, and baby may develop some consequences in adult life. And most importantly, when the mother is anemic, the baby of course is going to be anemic, and again there may be chances of preterm labor and neonatal infections and likewise. So it is always important to check the hemoglobin at all the levels to diagnose whether it is iron deficiency anemia or some other type of anemia, and treat the anemia at its first hand. Let's see what are the different foods that can help us to not to develop iron deficiency anemia. so that we'll consider the iron rich food. So what are these? So for non-vegetarians, the red meat, fish and liver, eggs, these are the most important sources of iron. They contain heme part of hemoglobin, that this is called as heme iron, while the vegetarian sources are called as non-heme iron. So what are the non-vegetarian sources of iron? So most important are the legumes, the seeds, then green leafy vegetables, jaggery, then raisins, some dry fruits like raisins, cashew nuts, peanuts. The green peas also contain a lot of iron. The turmeric, coriander, figs, these contain a lot of iron. And most important, what we routinely eat is whole grain cereals like wheat and rice, unpolished rice, and poha also contains lot of iron. Nachni is also very important. Nachni or ragi is very important source of iron. So these are the food we routinely consume. The broccoli, spinach, coriander, these contains iron. Moringa leaves contain iron. So there are plenty of food in nature which contain iron and what we consume daily. But the problem is iron absorption. So out of these all, only 10% of iron is bioavailable and it is only absorbed through the gut and it is assimilated into the blood. So for absorption of iron, it is very important to have a lot of vitamin C in the food. So we should use a lot of vitamin C in the food like citrus foods and lime juice, etc. Also, we should avoid eating, taking tea or coffee after food because it contains caffeine and tannin and it hampers the iron absorption. Also, food which contains phytates also hampers the absorption of iron. So, even if there is iron in the food, the absorption is not guaranteed. So we should take care of not having tea or coffee after food and use of citrus fruits after food is very important. Uh, so these are the food rich in iron. Uh, Now let's talk about few treatment remedies of iron deficiency. So in market there are plenty of iron salts available in different tablet forms, injection forms. The most commonly used tablets are ferrous sulfate tablet, which are distributed through government agencies. And in the market, ferrous fumarate and ferrous ascorbate salts are available in the tablet forms, and their absorption is said to be slightly better than the ferrous sulfate. And also the gastrointestinal side disturbances are less with ascorbate and higher molecules. Whenever patient is intolerant to the oral iron, then he must be given the intravenous iron or IV iron in the form of infusion because a patient cannot tolerate oral iron. What are the problems with oral iron is that one is the absorption is very low. Only 10% of the elemental iron from that tablet is absorbed. The second is if it is taken with food or if tea or coffee is taken along with the tablet or if calcium tablet is taken along with the tablet, then the iron absorption is hampered. So iron tablet should always be taken on empty stomach, either in early in the morning or at the bedtime at least an hour after the dinner. And no tea, coffee should be taken along with these tablets, and also the calcium tablet should not be mixed with iron tablets. Uh, Whenever the patient is intolerant to oral iron, we give these patients injectable iron or in iron infusions. These iron are available as iron sucrose complex and iron polymaltose complex, and these are given through intravenous line. uh, Total dose can be infused at one time or It can be divided in 3 or 4 doses at a certain interval. The aim of therapy is to replenish the iron stores. So whatever the iron deficiency is there, we have to supply that much iron, plus we have to replenish iron stores, which are almost around 1500 milligrams total iron stores in the body. So along with the treatment of anemia, we have to replenish the iron stores also. So calculating the dose is a formula. There is different formulas by which we can know how much iron is required for the patient depending on her hemoglobin, and accordingly we calculate the dosage. So best way is to give the nutritional supplement along with the iron tablets, and if it is not covered with iron tablet, then only we can shift to the intravenous iron therapy. Uh, what are the different uh, problems associated with these tablets is that uh, these can cause gastrointestinal symptoms, like there can be constipation or diarrhea, there can be nausea, bloating, gases, distension, dyspepsia, and blackening of teeth, tongue, and stools because of iron contents. So, to prevent iron deficiency anemia, I'll recommend all the women to use iron utensils. This is very important, and in today's era of non-staining utensils, aluminum utensils, and different fancy utensils, we have forgotten the basic iron utensils. And the most important source of iron, I'll say that it is iron utensils, because whenever we cook in iron utensils, we get a lot of iron from these iron utensils, and this can never cause iron deficiency anemia if it is used regularly. So that's all about iron deficiency anemia. I haven't gone into the depths of medical knowledge. I have given the practical knowledge of what is this iron deficiency anemia, how it is caused, what investigations to be done, how it is treated, and what complications are there with this iron deficiency anemia. I hope I have covered almost all the basics of iron deficiency anemia, and now we'll take different questions if there are any questions. Here is one question from Naina, from Preeti, that my ferritin level was low, transferrin level is normal. I am using ferroglobin serum for anemia. Does it cause yellow urine? The ferroglobin syrup is not only a plain iron syrup, it may be having other vitamins, and these vitamins can cause yellow urine. If the ferritin level is low, that means you have iron deficiency, because the ferritin is the most sensitive investigation of all. Transferrin level can be normal, but if ferritin is low, it is definitely an iron deficiency. The syrup forms contain very low levels of iron, because most of it is formed by water and syrup base. So I'll suggest you to shift on to tablet base. The next question is from Rachna. Due to too much weakness, I have done blood test. HB was too low. I have taken injections to increase iron named Vitcofol, still feeling the same weakness, and RBC is low. See, your iron HB was low, that means there is deficiency of all the factors that cause that will build up your hemoglobin. What are these factors? Is most important is iron, and the second is vitamin folic acid, vitamin B12 or cyanocobalamin, and protein. These are the 4 basic nutrients that are required for developing the hemoglobin. You are taking injection Vitcofol, which only contains folic acid, B12 and vitamin C. It doesn't contain iron. So whatever amount of Vitcofol you are taking, it will not replenish your iron stores and you will continue to be anemic. Instead of along with Vitcofol, you must take iron tablets. The next question is from Pratibha. Can both types of anemia, B12 and iron deficiency, be present in a person? Are they curable? B12 is 120 picogram. I think Pratibha is vegetarian because the B12 is low. That suggests that she is having vegan food. Vegetarian food has almost no source of vitamin B12 except for the milk. And those people who don't even drink milk and milk products, they are likely to have B12 deficiency. Also, there are a few other causes of B12 deficiency like malabsorption and intestinal problems. Your B12 is low, so most important part of your anemia is B12 deficiency, and you have to take B12 injections every week for a few weeks, and once the stores are replenished, then you have to take B12 every month in the injectable form, or you can take tablets of vitamin B12. Your also one question is that can both the types of anemia be present? Of course, it is very common to have both types of anemia, iron deficiency and B12 deficiency anemia. We call this as uh, dimorphic anemia, and this dimorphic anemia we call because of iron deficiency there are small RBCs, and because of B12 deficiency there are large RBCs, so there is dimorphism in RBCs, and it is easily curable by taking the supplements of iron with vitamin B12 and folic acid. Next question is from Pooja. How does iron deficiency anemia affect your body? See, iron is most important part of heme. Heme is composed from iron, and the function of hemoglobin is to carry the oxygen to the body. All the cells of body receive oxygen from hemoglobin. So, most important part function of hemoglobin is to supply oxygen to each and every cell of the body. So, whenever there is iron deficiency, there will be low Hb, there will be low oxygen carrying capacity, and there will be deficiency of oxygen supply throughout the body. So each and every part of body is affected because of iron deficiency or because of anemia. Each cell become slightly hypoxic, and there can be symptoms ranging from headache to backache, muscle cramps, leg cramps, easy fatigability, and all the symptoms can occur in iron deficiency anemia. The next question is from Namrata. What are the symptoms of iron deficiency anemia during pregnancy? Most important the symptoms of iron deficiency anemia in pregnancy, apart from whatever I have discussed earlier, is one thing called as pica or altered taste. So patient feels that as if eating some chalk or eating some soil, which are rich in calcium and iron. So she feels her taste is altered to have a liking for these sort of foods. So this is one symptom of iron deficiency. Other are again, I already told that there is easy fatigability and breathlessness. Uh, then there is if there is protein deficiency, there can be anemia, hypoproteinemia leading to leg edema and pitting edema on the legs. So these are the different symptoms of iron deficiency. There is one question from Mahesh. Can iron deficiency anemic patient take COVID vaccination? Why not? On the contrary, she must take COVID vaccination because her immunity is already at the danger because of iron deficiency. Should we need to take HB count done before taking the vaccine? No need for before taking the vaccine, but everyone should know her HB or his HB because it is the most important part of body which supply oxygen to our body. So everyone should be aware of what is her hemoglobin concentration at any given time. So HB count done before anything or done without any reason is always good. So I request everyone to always check hemoglobin at different intervals, say every 6 months or every year, to know the hemoglobin status and get the treatment according to the hemoglobin status. There is one question. I think it will be last question. The Nisha, she says, my mother is having vitamin B12 deficiency. It's 120 picogram per ml. Is it curable? She also has microcytic hypochromic anemia. That means it is a dimorphic anemia. She is having both iron deficiency as well as B12 deficiency. She is having microcytic and hypochromic, means it is iron deficiency, and B12 is 120, that means she is having B12 deficiency. She should take both iron and B12 as well as folic acid for correction of her anemia. B12 deficiency can be cured if properly taken. Uh, the vitamin B12 stays in our body for 3 years. So once we replenish all the stores of vitamin B12, next 3 years you may not get vitamin B12 deficiency, but it is always better to take monthly injections of B12 or at least B12 tablets daily till all the stores are replenished. And the underlying cause of this must be known, whether it is malabsorption or whether it is a nutritional deficiency, that must be known before taking the treatment. And the treatment of underlying cause is also must. So with this, we come to end of today's talk. I think I have explained the basic parts of all iron deficiency anemia, and I have answered to almost all the queries scientifically. Thank you for patient hearing, and thank you for today's opportunity. I thank Baby Chakra for giving me this opportunity to interact with all the uh, expecting mothers and all the audience. Thank you.